Good afternoon, Camry Case. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It's always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel is your greatest skill as a nurse.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. Please start your OET speaking roleplay.
Good morning. I am Nurse Camry Case, one of the community nurses. Am I talking to Mihiraa?
Oh, hello, nurse. Yes, I am Mihiraa. Thank you for coming.
Hello, Mihiraa. It's so lovely to see you, and I truly appreciate you having me in your home today. The main reason for my visit today is to see how you're progressing, to discuss how you're managing here at home, and most importantly, to listen to any concerns you might have. First and foremost, could you tell me a little more about how you've been feeling, both physically and emotionally, since the fall?
To be honest, I've been feeling a bit low since the fall. It's shaken my confidence more than I expected.
I can absolutely understand why you'd be feeling that way. A fall can be a very frightening experience, and it's completely normal to feel a bit shaken afterwards.
Well, the pain in my hip comes and goes, but it's worst when I try to get up. It makes me not want to move at all. I'm also worried that I'll just lose my balance again for no reason.
Thank you for sharing that with me, Mihiraa. It's very helpful. I want to reassure you that what you're experiencing is very common. It's expected to have some pain and discomfort after a fall, and this will gradually subside as your recovery continues. The pain medication you've been prescribed is there for a reason, so please to use it as needed to stay on top of the pain, as this will actually help you move more comfortably. Following all the medical advice you've been given is crucial right now because it directly aids your recovery, helps prevent any further injury, and is the best way for you to maintain your overall health during this time.
I'll follow the plan, but how do I stay safe and avoid falling again?
To help you feel more secure, Mihiraa, I'd like to discuss some simple methods we can use to prevent another fall. For instance, we could look at securing any loose rugs you might have, making sure you're always using handrails on stairs, and that you're wearing firm, non-slip footwear around the house. What are your thoughts on these ideas? And do you have any specific concerns about your home environment?
The handrails are fine, but I do have a small rug in the hallway that sometimes moves. And I usually just wear socks indoors. I suppose that isn't the safest, is it? Well, I hate being at home. How can I recover faster and gain confidence?
Those are excellent observations, and it's very smart of you to make those connections. Addressing those small things can make a world of difference. Another key part of your recovery and building your confidence back is physiotherapy. This provides you with specialist support from a professional who can guide you through specific exercises. The goal is to gently improve your leg strength and your overall balance, which will, in turn, increase your range of movement and make you feel much steadier on your feet. Having that support is so important. Speaking of support, could you tell me a little about the support network you have here at home?
My daughter lives about half an hour away, and she calls every day. A lovely neighbor, Susan, pops in to do my shopping, but she works during the day. I feel a bit bad asking for more help.
It's wonderful that you have your daughter and your neighbor Susan involved. That is a real strength. Mihiraa, please don't feel bad about asking for help. People who care about you want to be there for you. Given that there are times when you are alone, it is very important that we have a clear plan for what to do in case you have another fall. If you were to fall and you are not seriously hurt, the first step is to try and call a family member or your neighbor for assistance. If you cannot reach anyone, or if you are in pain or believe you are injured, you must call for emergency services immediately. For less urgent issues, you should always contact your GP or the community health center. Having this plan in place can give you and your family great peace of mind. To finish up my visit today, Mihiraa, I would like to do a quick observation of your mobility, just to see how you're moving and to check the area where you had the fall. Would that be all right with you?
Yes, of course that's fine.
Mihiraa, let me just recap what we've discussed so you have it clear. Firstly, we talked about how feeling sore and a bit shaken after a fall is completely normal and that it will get better with time. Remember to use your pain medication as needed, as this helps you move and recover more comfortably. We also went over some important steps to make your home safer, like securing that hallway rug and switching to non-slip shoes indoors to prevent another slip. A key part of your recovery will be the physiotherapy, as the specialist will help you build your strength and balance back up, which is the best way to regain your confidence. You mentioned your daughter and neighbor Susan are a good support, which is wonderful. We also made a plan for what to do if you were to fall again. First, try to call a family member or neighbor. If you can't reach anyone or you're hurt, call emergency services right away. For anything less urgent, your GP or the health center is the best contact. Finally, you've kindly agreed to let me do a quick observation of how you're moving now. Does that all sound right to you? And is there any part you'd like me to go over again?
Thank you for explaining everything so clearly. I do feel a bit better about it all now.
You are most welcome, Mihiraa. I'm glad to hear that. Let's take a look together then.